We thank you for joining us today for part one of our town hall series on long-term care. The Toronto Council on Aging is a nonprofit organization that is committed to addressing the issues and concerns of older adults in Toronto. Our vision is to create a community that respects, values, and empowers seniors. Today, we have a very special group of panelists lined up, and during today's session, we will be discussing strategies to advocate for positive change in the long-term care sector. Many of us have seen the headlines on long-term care and how COVID-19 has revealed many of the deep-rooted issues in the overall system and model of care. During today's session, we hope to come up with sustainable solutions that we can use to advocate for change. So before we officially start, we would like to have a land acknowledgement. Today, the Toronto Council on Aging acknowledges that we live, work, and play on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, and the Chippewa and Haudenosaunee and Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. The Council also acknowledges that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, the Williams Treaties, and signed with the Mississaugas and Chippewas Band. I will hand it over to our moderator for today, who will discuss some of our housekeeping items and meeting etiquette. Kathleen, over to you.
Hello, everyone, and thank you so much for joining us today. My name is Kathleen Edwards, and I am a member of the board for the Toronto Council on Aging. So I'm going to be the person behind the scenes, admitting people, and just kind of monitoring the Q&A and chat box for your questions later on in the session. Because we are having breakout rooms and smaller group discussions in the second part of the program today, we're going to ask that you will mute yourself during the first part when our panelists are speaking, and that you keep your camera off. That way it just kind of helps with the bandwidth, but please try your best to keep your microphones muted for a few reasons. One, it just downplays the background noise that we're having to filter through when we're listening to what the panelists have to say. And we're very lucky to have such an amazing panel of experts today, but also because we are going to be recording this session so we can share it later. So it just helps to make sure the audio quality is as high as possible. Again, as Tasha mentioned, the whole purpose of this meeting is for us to get some ideas for what it is that the TCA can do as far as advocating for change. So really, we want you to focus the discussion on, what are some solutions that you might propose? And again, so later on in the session, I'll just remind you of how the breakout rooms are going to work when it's that time. But thank you so much for joining us today. As I said, if you have questions with the technical issues or about how to use something, please let me know. You can just message me in the chat box. And without further ado, I'm going to hand it over to Tasha again, who's going to introduce Josh, who is our moderator for today. So we are very lucky. I actually sat on a panel that he did a few months ago about long-term care. So Josh Matlow is going to be joining us. He is a member of the Toronto City Council, and he is the seniors advocate within the City of Toronto. We are very blessed to have him serving as moderator today and lending his expertise and his skill in facilitating. So Josh, I'm going to hand it over to you as you introduce our panelists for today.
Thank you so much, Kathleen, and it is an absolute pleasure to be here. I'm a longtime supporter of the Toronto Council on Aging, and we're joined here by some panelists who I have, and I know that we have, such enormous respect for the work they do and the contributions that they make to the goals towards improved long-term care in Ontario, along many other issues that they focus on. So I'm going to begin with John Fraser. John Fraser is the member of Provincial Parliament for Ottawa South. He serves as the Liberal critic for health and long-term care. For a number of years, John served as a palliative care volunteer at the general campus of the Ottawa Hospital. It was therefore not surprising that John was mandated to support the development of a comprehensive strategy for palliative and end-of-life care in Ontario. It is a mandate he asked for, and one that he is grateful to have. He has long been guided by the firm belief that how we care for each other at the end of life is as important as the beginning of our lives. In April 2020, John wrote an open letter on the state of long-term care in the province. In his letter, he asked to close the loophole allowing temp agencies to send workers into multiple homes, ensure all frontline healthcare workers have access to the PPE they need to stay safe, enhance wages of frontline workers in long-term care, group and retirement homes, including PSWs, DSWs, to stabilize the workforce. It'll be interesting to see how John's open letter and other advocacy efforts may have resulted in the change over the past year. Next up is Moira Welsh. Moira Welsh is an investigative journalist with the Toronto Star. Moira has co-authored investigations that have won 3 national newspaper awards and a Missioner Award for public service journalism. She was a finalist for the, how do you pronounce this, Justicia, excuse me, thank you. I need to ask a journalist for that advice. Award for legal reporting and the Canadian Hillman Prize. She started as a breaking news reporter and soon joined the investigative team where she has written on social justice, the environment, and the lives of people living in seniors' homes. She is the author of a book about long-term care called Happily Ever Older, Revolutionary Approaches to Long-Term Care, which takes readers across North America and into Europe on a tour of long-term care homes and approaches to senior care. Moira lives in Toronto with her family. And lastly, but certainly not least, Andre Picard. Andre Picard is one of Canada's top health and public policy observers and commentators. He's been part of the Globe and Mail team since 1987, where he's a health reporter and columnist. He's also the author of 5 best-selling books, an 8-time nominee for the National Newspaper Awards, Canada's top journalism prize, and past winner of the prestigious Missioner Award for Meritorious Public Service Journalism. He was named Canada's first public health hero by the Canadian Public Health Association, as a champion of mental health by the Canadian Alliance on Mental Illness and Mental Health. He is also the recipient of the Queen Elizabeth II Diamond Jubilee Medal for his dedication to improving healthcare. His most recent book, Neglected No More, was released on March 2nd, 2021. In this book, he explores the current crisis in elder care and offers some solutions to address the broken system, which, as we know, is much needed and is the focus of our conversation today. So I'm going to begin with a question that takes us one step backwards, because of the rest of this event is all about how we move forward in a positive direction. So I'll begin with John, given that you've written a letter about this, you've been advocating about this. There was a lot of problems with long-term care in Ontario long before the pandemic. The Armed Forces report certainly demonstrated that. The LTC Commission has demonstrated that. What were the challenges that you identified even before the pandemic that really should have been better focused on and didn't put us into the strongest footing facing a global pandemic?
Well, thanks very much. I'm muted there. I'm unmuted. Okay, great, good. Thanks very much, Josh, and thanks very much to the Council on Aging for inviting me, and it's a real honor to be here. And I think the thing that strikes me the most is staffing. Is what we do to support the people. And my former boss put it quite, Premier McGinty put it quite clear to me one time. It was, the people who care for the people we care for most. It's amazing how important that 45-year-old man or woman is who's taking care of your mom or your dad because you can't. And so I think that's the biggest piece. And even before we got into this pandemic and throughout even being in government, that was a big challenge. I've been through my mom is still alive, but my father passed away and my in-laws both passed away. So I've been through a long-term care journey with two of them. And they were at a very good home. But even there were some really serious challenges. One of my family members there was an incident there, that critical incident with one of them, and so it was kind of an eye opener, right? And so I spent a lot of time thinking about it, one of the things that I think is something that's kind of backwards. You said that there's that little piece I was talking about, how important it is to care for ourselves the way we care for us when we come into this world. Well, if you think about schools and you think about hospitals, you think about childcare, they're all community-based. They all have some level of community governance. We're integrated into that. And if you look at long-term care, the way it's an institution, and it doesn't report to the community the way that those other organizations do. They don't, it's not the same level of accountability and connection with community too on the other side. And so I know that's, to me, that's kind of strikes me as, it strikes me as just when we look at the model that we're using, how can that work? How can it work if a long-term care home only reports to the Ministry of Health and Long-Term Care and a head office somewhere in Ontario or in downtown Toronto? And so I think a community-based solution is what's needed. We no longer, I'll give another example, the developmentally disabled. We would not, nobody would stand for right now building a home with 200 beds or 200 rooms, would they? So a lot of it's what our expectations are, and we have to look at a different way of doing things. We have to look at localizing it, and it's not just about long-term care homes. It's about how do we allow people to live in community. Like that's the really big piece. I think that that we have to try to focus on, and we have to just shift our focus that way. Because right now we're going to build. The government's going to build another 30,000 long-term care beds. Are we going to get a different result? Like, what are the other pieces in there that are going to give us a different result? So, there's a plan to improve staffing, but I don't think that's going to work because number one, I don't think it's enough, and I don't think we're looking at different ways of approaching this challenge that we have, and allowing people to age in place, and quite frankly, connecting them to community. And COVID's just made that so evident that I really believe the government's not going to solve this. The communities are going to solve it and push government to come to that solution. That's what I think has to happen. And I think one of the things is every community has different capacities, right? And that's one thing that works really well in hospice. Like hospice is one of the greatest expressions of community-based solutions, right? Basically, they grew out of necessity, and government didn't even fund them. And even now, they're still very much community-based, and there's a high level of involvement from the community. And still, there's an involvement of government, but there's still a need to drive, a need for the community to be connected to that. That's because people felt a need to address allowing people to live well up until the end. That was important. And so it should be important for people in long-term care too.
Thank you, John. Moira, everything from long-term care homes not even showing up on the digital divide debate before the pandemic. You've written a lot extensively, as you know, I know, about emotion-focused care and not just treating long-term care homes like institutions, but as homes to support those who live there and work there. What did you identify pre-pandemic, along with screening and anything else you'd like to mention, that, could have been done better and perhaps need to be a focus on improvement moving forward?
I would say the entire system needs to be transformed. To begin with, I believe that I agree with John that we need a greater focus on the staff. And I've talked to a lot of leaders of homes who say the first way to transform a home is to treat the staff the way that you would wish the staff to treat the residents. And that's a beginning of a cultural shift. And so that's a really, really important piece. And given the fact that we have such a staffing shortage, I would argue that the homes that can provide workers with a sense of purpose and meaning in their jobs and the ability to have some autonomy around the decision making, the emotional care of the people they care for, would attract people and actually help retain them. But the other piece of it is the system remains or will remain entrenched in the institutional style of care. And unless we really focus on creating different philosophies and models within homes. And so right now we have the task-focused system. So every worker is rushing from one job to the next, and the people are incidental, in a sense, to their work. And I say that with respect to the workers who are also trying very hard to care for people. The other piece of it that I find really interesting is the design of homes. And we've seen homes with 32-bed units, so to speak. Nobody ever lived in their regular adult life, other than perhaps a year or so at university, in a home with 32 beds. And so even if we're not living in the community, and there are some people who do need that extra care of a long-term care home, you can build them with very small, intimate households where you have an individual kitchen, you have perhaps 7 to 10 people living there, there's a shared dining room. The homes I've seen, people can sit and have a glass of wine before dinner. They can bake cookies if they like, if they're in the mood for that. And the workers are dedicated to that unit. And in fact, the Journal of American Medical Directors found that during COVID, those smaller households had far, far fewer cases of the infection within those homes for the simple fact that they're smaller and they have dedicated workers coming in. So there are several pieces that are ripe for change. And I think that if we only tackle 1 or 2 of them, we won't truly transform the system.
Thank you so much. And Andre, like Moira, some people have a lot to say on the topic. You've literally written the book on it. So, what have you identified, even pre-pandemic, that really just needed to be changed to better support those who work and reside in long-term care?
I think first I'd have to start by repeating what John and Moira said, that it's important that we have great homes, that we have, community care. It's really about a whole continuum of care. It's not just about building more beds. I think the worst thing that come out of COVID is if we just build more mediocre care. That's not what we need. We need to rethink the system, as Moira said very well, to ensure, everybody has the right care at the right place at the right time. That should be our goal, this entire continuum. So I think that's the much bigger picture. When we do build homes, and there's no question, some people will need some care in some kind of home institutional setting. They'll need 24/7 care. I had 2 parents with dementia. They needed care, but it has to be, again, the homes should be like homes. They shouldn't be like prisons. They shouldn't look like these facilities that no one wants to go to, that everyone dreads. So there's some pretty fundamental technical changes. I think there's a philosophical change that is needed in society that the others haven't mentioned. I know they both talk about this, they know it, but I'll just build on that a bit, that we have to stop catastrophizing aging. We have to stop saying it's horrible to be old. It's not. The vast majority of people who are elders have a good life. They're healthy. They live in the community. And we have to make it easier to live a dignified life. And I think that's what we have to aim for. That it's a small percentage of people in institutional settings. There's still far too many. There's about 400,000 people in Canada in institutional settings. It's about 7% of seniors, but it's still too much. But let's not forget the other 93%. Let's make our cities more senior friendly. I always quote Rick Hansen. Everyone knows the great wheelchair athlete Rick Hansen, who always says, there's no downside to accessibility, right? If it works for somebody in a wheelchair, it works for somebody with a walker, someone with a stroller, there's no downside to doing this, to making our homes more accessible, our cities more friendly. So I think it's the whole spectrum, and let's not just think about taking care of sick people when they're sick. Let's think about making people's lives better overall.
You know, and everything that we just discussed, whether it be creating age-friendly, accessible cities, whether it be about improving long-term care homes in a whole variety of ways to create homes rather than institutions, we could be having this discussion at any point. We could have had this 2 years ago. So, you know, looking at all those indicators, looking at the real challenges and problems that we all are aware of, how have these problems, these challenges, impacted or perhaps even exacerbated the experience that we've gone through over the past year, where now we've seen at least during the first and second wave, the vast preponderance of deaths occur in those homes. Moira, would you like to begin this?
It's ageism. Ageism. It's the way that, as Andre points out, the way that our society views growing older, and the way we view it as a society is the way that we have enabled these homes to act as institutions and to, in a sense, turn our backs to the people living in them when the pandemic hit, and place our focus, perhaps rightly, as we're now seeing, on hospitals. But at the time, there were a lot of calls for extra help in long-term care, and they went unheeded for a longer period of time than they should have. And I believe that the whole system is sort of set up to look at older people as if they are others. And even the way that we measure long-term care, for example, the only system or the only group of people that are measured for their trips to the hospital are residents of long-term care. And that is considered a negative. So people don't get the health care that they rightly need as a Canadian citizen because they're living in a nursing home. And that creates essentially a group of second-class citizens.
Andre?
Yeah, I think the most tragic part of COVID-19 is how this was so predictable, what happened in our long-term care homes. I don't think we can overstate the breadth of the catastrophe. You know, there's been about 23,000 COVID deaths in Canada, and almost 17,000 have been in these institutional settings. And the real tragedy is we saw this happening before it happened in Canada. Before you had a single case, we saw this happening in Italy, we saw it in Spain, we saw it in China. We knew who was going to be affected, and we did nothing. You know, we talk about this iron ring, but there wasn't even a paper ring put around these homes. They didn't get proper PPE. We protected our hospitals really well, and we just forgot about people in other institutions. And what happened in hospitals is proof that we could have prevented almost all of this. So that, to me, is the real tragedy. The other aspect, I think Moira pointed it out very well, how we treat this group of people, how we treat elders differently. She cited the example of, we count their hospital visits and that they're punished for that. We also have home care. Home care is the only service in Canada where you have arbitrary caps, where we say you're only allowed a maximum of 3 hours a day of home care. It doesn't matter how many you need, you're getting 3. I always use the analogy. I say, imagine if we said to a cancer patient, you need 15 sessions of chemo, but sorry, we only pay for 3. Can't do anything about it. The rules are the rules. We have to treat people better overall.
John, I mean, at the beginning, you or actually just pre-pandemic, you saw the government make a number of decisions where there were fewer inspections, where I can attest to the municipalities were getting fewer funds for local public health units. What did you identify at that point that you believe exacerbated the problem?
Well, I think that I think the decision making about what needed to be done was unduly long. And the reason that it was unduly long was people were thinking about how much money it was going to cost. I mean, the reason we didn't raise the wages of PSWs in long-term care was the government waited till the federal government put some money forward for that. That didn't happen in Quebec. That didn't happen in BC. They knew what they had to do right away. And that just made things worse, right? And then they felt they couldn't make the decision to ban, to stop workers from working more than one home. So that just allowed the diseases, and it's been this is not a partisan thing. It's just very clear. There's been a succession of delayed decision-making, whether that comes to staffing, whether that comes to addressing the pandemic of isolation, you know, in terms of what was happening to residents. You know, people were, I think when we see this, when it's done, I think isolation will have taken maybe not as heavy a toll as COVID, but it'll have taken a big toll. And I think somebody said this to me who'd been in government, you know, or, you know, back in the 2000s, we were talking about what was happening. And they said, you know, we've always said in long-term care, well, that's enough. You know, in other words, that's enough. Governments, that's enough. It wasn't enough. And when we had to move quickly now to address the needs, government, not just governments, hesitated, in particular in Ontario, to apply the resources that needed to be there to make sure that people were safe. And it was time for us to act, and we didn't in Ontario. Yeah, it was like watching watching in slow motion a train wreck. Even with staffing, right? You know, Quebec moved so quickly last summer, and Ontario was still trying to figure things out in September. They let pandemic pay lapse. And to me, that's really at the root of those things, is like that inability to say, we got to do this right now. We're going to have to put the resources there. It's not the resources weren't there. Anyhow, I think that's the way I see it, and from square one. And it's still at that situation right now.
Now, each one of you have either said or alluded to the fact that there needs to be a culture change regardless of the pandemic. It needed to happen before, but you've also identified a number of factors that either made things worse or just could have been preventable. So moving forward, whether it be just what you've observed, whether it be what's come out in the commission, however you've learned it, if we were going to do something now to both make long-term care safer, and then regardless of the pandemic, just a better place for the workers and the residents, what would the top priorities be? If you were in a position, and all of you are in a position to advocate for those in your own way, what would be your top priorities? I'll start with Andre.
I think everyone has alluded to this already, but it has to be staffing. You have to start where the biggest problem is, and the biggest problem is staffing. We need, healthcare is all about people caring for people, so we have to have the right staff, right ratios of staff, the right kind of staff, the adequate numbers. You know, Pat Armstrong, a sociologist at York, famously says the conditions of work are the conditions of care. So we'll never have good care unless we have good staff and they're treated well, and Moira said this earlier. So I think that has to be the starting point without question. And how do you do that? Well, you do what Quebec did. You announce large hiring sprees. Quebec hired 10,000 long-term care workers, paid for their training, offered them, doubled their wages. They went from $13 an hour to $26 an hour. That's what you have to do. We have to do a lot of catching up. So you do that, and then you put in standards of care. You say minimum 4 hours a day of care, hands-on care for everyone. You cost that out. Ontario knows how much that costs, $1.8 billion. They've committed to do it. Why they've committed to do it in 2 years is beyond me. They should be committing to do it yesterday. So do that. And then you talk about what's the mix. So what's the mix of personal support workers to nurse practitioners to LPNs to RNs, and you cost that out. So you have to do it very systematically.
What do you say, John?
Well, I think if we're looking at moving forward, there are two things. In the homes right now, staffing is the key issue. There's no question about that. I think there's one other piece that is really critical in long-term care. And I come from the grocery business, so sorry for this analogy, but if it was busy on a Saturday morning, everybody was at the front of the store making sure people got through the caches. So likewise in long-term care, everybody who works in that facility their top priority is the immediate daily needs of the people who are there, right? And I think, I've had a chance to visit different homes over a period of time. And in the homes that I found that happening in, their results were much better. Residents were happier. Staff was happier. I think that's the kind of ethos that has to be inside each home. And I alluded to this earlier. We have to return the care for people who are aging and long-term care back to the community. It has to be part of the community. We have to support. We have to be better supporting municipalities and not-for-profits and community organizations who are trying to build homes or trying to do something innovative. We have to help from a government perspective, provincial government perspective, support those initiatives that exist in communities, not just support them, but incentivize them. And so that's sort of two separate things. What do we need to do in the homes right now? But what do we need to change the way that we do things? And that's look to communities to tell us, right? And it's not always going to be the same in each community. Right? They'll come up with different solutions based on their capacity and their leadership. And so that's how I see it.
Thank you. And Moira?
I would agree on the staffing issue. I think it is very important, but all of these changes and the need for them and extra funding matter immensely. But unless we actually change the way that we view homes, the people who are living in the homes and the people working in the homes through these transformational philosophies or models of care, the institutional system will prevail. It's too powerful, it's too entrenched. And so a few extra staff, while deeply welcomed, will not make that difference. But if you train those workers in these new models or philosophies, then that will make a significant difference overall. And the leaders of the homes actually have to really buy into this, or else we will be continuing the old style of homes to the future. And the homes that they're building right now, I'd like to say to people, will last for the next 30 years. So the final wave of the boomers and the Gen Xers potentially could be living in those homes in the future. So let's just take this opportunity now to really fix it and not just be grateful for a few offerings from the government. That's not good enough.
We've also discussed, the need for, again, culture change, transformation, making it safer, making them less isolated and lonely, changing even how we address our senior population. But all of this is going to take some money, whether it be about initial investments into emotion-focused approaches, to better staffing, to better facilities, to everything involved in this. And we have a government that, due to COVID, is going to have many years now of deficit budgets. So how do we make the change? And that's the question that most people end up asking, I think all of us. It's one thing to say we have an idea of what we would like to manifest, but how do you get from the aspirational place that we're in now to actually convincing our government to do everything we are hoping they do? How do we get from aspiring to making all the changes that we've discussed to actually convincing a government that either won't have a lot of money or may not simply want to spend it? But either way, how do we get from aspiration to manifestation? And I was gonna begin with John, simply because he's the politician on the panel. But but if you need to deal with something, I want to respect that. John, you're on mute, by the way.
I missed. I was trying to get somebody to turn something down here.
I appreciate that. I've been in many meetings where I've had either my daughter or a cat or something coming to me, so I hear you. No, I was simply asking, how do we get from aspiration to manifestation? How do we convince a government, regardless of the stripe or the party, to get from where we are now to actually getting the change done?
I really firmly believe it starts in community. And what we have to do is organize ourselves, whether it's a municipality or town or a neighborhood. People have to come together to talk about these solutions, because if we leave it to government to coming up with a solution, we're going to get, and we're getting it right now, we're just going to get more of the same. That's what's happening right now. So I think, I also always go back to the hospice model and just how that's worked in terms of sort of transforming dying, and it's helping to kind of change. There's a lot more to go, don't get me wrong, but it's come a long way over a long period of time, and that was driven through communities. And I think you build a network of communities. I think things like compassionate communities are a good thing to help drive that change. I mean, there's always the question of resources. That's been the question for the last 40 years. And so one of the things I think that what communities have to demand of all their politicians at any level is, we want all three of you to work together to solve this. Come together, find a way to get the resources that are there, because that's what we need. But as Moira said, is there's we've got this thing, we're competing in ageism, right? Where once you're as I approach it, I'm in my 60s, as I'm approaching it, what's my best before date, right? That's kind of, we think we have to think differently about aging and about people's ability to have quality of life. Right? There's this sense that we have where we think, when I get older, it's no good. It's no more fun, right? It's just a slow decline. And I'll try to be quick here. I've seen what recreational programs do, like art recreation programs do in long-term care homes, in communities for seniors. How do you actively engage people in community? I think it has to be driven from communities, asking all three levels of government, and it's happening right now. We're talking about standards. We need more than that. We need, and that's going to require governments to say to people, we're going to have to adjust how we're using our resources, right? Less of this and more of that, or we may have to ask you to do more. It's just like, it's not going to happen otherwise. We can't kid ourselves. And, but I think, organizations like Toronto Council on Aging, the Ottawa Council on Aging, you have compassionate communities here in Ottawa. They have to, you have to build that momentum to get that change. Because we run the risk of sort of ending back where we were before, after the pandemic. I think that's been said a couple of times already.
Thank you, John. And Moira, you've covered a lot of politicians. Have you discovered any insight into how to convince them, and I'll include myself in that, to actually do something about what we talk about?
I think that the greatest expense is probably going to be the staffing, which at least the province of Ontario has already committed to. I know people say that these programs are very expensive, but in many ways they're not. And I'll just use the Eden Alternative as an example. So training for one person, for example, for Eden Alternative is probably several $100s. And so the home I visited in Saskatoon, called the Sherbrooke Community Center, they originally, I think they went with a group of 7 people to a session, and they wholeheartedly embraced this as leaders and continued. So they just kept working. So they were trained, paid to be trained initially, and then continued that program throughout the home, and it evolved over time. there wasn't a lot of expense to that. As Sue Ellen Beatty, who's the CEO, would say, what we're trying to do is eradicate loneliness, helplessness, and boredom. So what do you really need for that? Yes, you need the training to change the philosophies and to bring the worker and the staff on side, but that's really what you need to do. Other homes, Butterfly, came here to Ontario, a much more expensive model. It is my understanding that they have significantly lowered the price. They have new ownership and they've changed the way that they offer the model of care. So there are those options as well. But I think also that what the governments and critics don't look at are the changes in the way it transforms homes. So people often talk about, and I could cite Jill Knowlton from Primacare Living, who has said on the record multiple times that through this transformative model of care, homes, the residents no longer have the so-called behaviors, which is actually quite a negative term that people give to people often with cognitive decline. But that's because they're not sitting in a chair for weeks and weeks at a time, never getting outside, never having anything to do to occupy themselves during the day. So no wonder people get bored and lash out and are angry. And so those behaviors have been, for the most part, according to Jill Knowlton, eliminated. There are also fewer costs related to perhaps hospital visits, which the system doesn't like. But there are a lot of benefits to these programs that are sort of softer benefits that we see later on.
Thank you. And Andre, I'll give the last word to you as we wrap up the session before we go into the Q&A with those who are participating today. And just in the next few minutes, we're going to come to you and take as many questions as we can take. So Andre, how do we get government to go from what we know we have to do to go and do it?
Well, I think we have to stop using money as an excuse. We're a wealthy country. It's about priorities. I've never seen a government refuse to build a highway when there's a new community. So we have to build highways of care for people throughout their lives. The fact that people are living longer is a good thing, and we shouldn't say it's a catastrophe and it's expensive. Yes, it's great that they're aging, so let's take care of them. So I think stop using it. I think we have to recognize that we spend a lot of money now and we spend it poorly. So if we start getting more value for money, we could do a lot more with the money we spend. I'm not convinced it would take a lot more money to fix the system. As Moira said, a lot of it is about philosophical change. It's about doing things differently. I'll just give you an example. Take something like people want home care instead of long-term care, right? So say have a rule like they have in Britain. You can spend as much as you want on home care as long as you don't exceed what the equivalent cost would be in institutional care. So we give people roughly $200 a day in government subsidies in institutional care. A lot of people could do a lot with $200 of home care, and just give them a choice. That costs not a penny. So there's a lot we can do. The final thing I'll say on money is how much have we spent in our COVID-19 response? I think the last calculation I did was roughly $500 billion, $500 billion has been spent on COVID relief. What's another, say we need $3, $4, $5 billion to fix elder care. So what? It's petty cash, to be honest. In the grand scheme of things, and I come back to my first point, what's the most important thing? What are our priorities in society? And I think one of them should certainly be caring for people who've built our society. You know, this generation that has given us Medicare has been forsaken by it, and we have to fix that. It's just untenable to me.
Mm-hmm. Thank you so much. Very well said. I love the highway of care. You should be a writer. I like that.
Let me know if there are any job openings.
Yeah. So we're actually a very punctual railroad here because we're getting right to the right time to get to the Q&A. So I'm going to ask Kathleen, who was introduced to you before. She's going to act as sort of like our producer here. And so she's going to go to the participants and really without any order of import, just try to go through as many questions as possible, and she'll sort of throw them over to me, and then I will navigate with the panelists to make sure that everybody has a fair chance to respond. So Kathleen, over to you.
Thank you so much. And we've had some great questions come up in the chat already. So the first one, so discussion about staffing, and someone asked, why are PSWs not a registered profession? And how would having them become a registered profession kind of serve as a strategy to make sure their education is consistent across all institutions in Ontario?
So, Moira, would you be equipped to answer that?
There has been discussion about a registrar for PSWs, and I know about a decade ago there was a lot of talk about it, and it went away. It is my understanding that there's a bit of controversy around that, quite a bit of disagreement. I'll be honest, I haven't really delved into why people disagree with that. It on the surface, it makes sense that there would be a way, a college to perhaps represent PSWs and to elevate the value of their profession. But I personally have not found the alternative side, so perhaps somebody else can weigh in on that.
So perhaps Andre or John. John, do you have something to add to that? And take yourself off mute.
My gosh. Thanks. No, I had the opportunity for 3 years ago to be working on scope of practice, which was all the colleges and how we manage that. And there's reticence on government to create another college because we have, I think, 24 already. And so, but I think it's the right thing to do. It's such an important piece of care. And it's also an opportunity, because what you want to do in those professions is to build up people's capabilities, right? To their scope of practice. So with the college, you're able to more professionalize the work, give people educational opportunities, give them opportunities for being a specialty person. You know, I went to a long-term care home where a PSW was the head of their palliative care. She was the lead, and because she had the experience and was a great leader. So it's we should have one. I think the reticence has really been that governments don't want to create another college, but we should.
Thank you. And Andre, do you want to opine on that?
I can briefly. I think, you know, the basic answer is there's no rhyme or reason to why some professions have a college and others don't. We have a college of acupuncturists, but not a college of personal support workers. It doesn't really make sense. The second thing I say is it doesn't really matter ultimately. Some provinces have them, some don't. What matters is people have to know that the person caring for their loved one has adequate training, has the abilities to do it. So we have to figure out a way to do that. And there's more than one way to skin that cat, but that's what matters to people. And that doesn't exist in Ontario now. Anybody can hang up a shingle, say I'm a PSW, and that leads to abuse and it leads to exploitation of families and people who need care. So we have to fix that, but the solution, there are many possible solutions.
Thank you. Okay, Kathleen.
There was that great question raised in the chat about, is ending for-profit really a solution to all of the problems? So just comments on the for-profit, not-for-profit, as well as the municipal-owned homes. What are their roles? What are the pros or cons of changing how the system is organized? Is there one approach, so nonprofit being the way, or funded the way that we fund municipal homes? What is the best solution for the format for how homes are owned?
That certainly has been a big topic of discussion throughout the pandemic, and certainly there is a lot of information comparing perhaps the relative success of the municipal homes versus many in the private sector. I'll begin with John.
Make sure. Oh, I'm not on mute. Okay,
You're
great.
Yeah,
I'm unmuting myself when I'm already not on mute. Look, we have to go in a different direction. After watching over a number of years, and especially through the pandemic, I just think it has to be community-based. And it's a lot of, it's a community. I believe in not-for-profits, municipally run homes that are connected to their community. I just think the for-profit model doesn't respond to the community and isn't as accountable as not-for-profits and municipal homes are. And I think that's the direction that we have to go in. You know, I see what what the government's doing right now in terms of the new beds they're dispersing across Ontario. And I don't think we're going in the right direction. I think we have to find a way to work with municipalities, work with communities, say, look, what can we do to help you build a place for your community? And so, 4 or 5 years ago, I would not have felt the way that I feel right now. But I think I didn't feel the way that I feel right now. I think COVID is really revealed just what's happened with long-term care. Essentially, to take debt off our books, we are going to corporations to allow them to build an asset. And it feels they got two things that are being tugging at, right? They need to make a profit and build an asset and to provide care. I don't think they fit.
Now, because I'm cognizant that we have just
sorry.
Don't be sorry at all. I think I would appreciate your answer. But just because I'm cognizant that we have 9 minutes before the end of the Q&A, what I'm going to do is each question I'll just go to sort of one of you, and then if either of you have sort of a brief sort of supplementary that you'd like to add on, like a thought, that might be a good model to use. So Andre and Moira, is there anything that you would like to add on to John's comments?
I would just say I worry about a simplistic solution to a complex problem. So ownership matters, but it's not a panacea. Quebec only has 10% private ownership. Ontario has 60%, and they both had horrible outcomes. So let's not oversimplify this. John hit the nail on the head. We should be asking, why do we have, I don't think we need for-profit operators, but we have to ask why we have them. And we have them because governments refuse to invest in infrastructure. And, we have poor outcomes because we have poor models of care. So if we did what Moira says, if we have models of care, it doesn't matter who owns it if it's proper care. And the final thing is a lot of private care is not these huge faceless corporations. It's families who own these homes in municipalities, and those aren't bad things. We have to get the slum landlords out of the business, but they're a minority, and that's what we have to target rather than ownership per se.
And Moira, do you want to add any last word on that?
I would quickly agree essentially with what Andre said. I think there are some, we've seen some homes that have not devoted themselves the way we would have hoped during the pandemic. And so I think that is a reckoning for them. Frankly, some of the homes that I write about and am inspired by are for small family owned for-profit chains that are actually doing some really interesting work and getting new contracts from the provincial government to design some really small households and inclusive communities that they're building as a campus of care. And so they're actually the innovators, the progressive homes.
Kathleen, next question, please.
All right, so this will probably be a good one to wrap up the discussion before we head to breakouts. But I know CanAge, which is a national advocacy organization for seniors, is really leading the stage when it comes to, actually they have a survey out looking into national standards. So to the panelists, what role could national standards of care play given that homes are provincially funded and provincially regulated? And I know in Ontario, we're very regulated compared to some other places for long-term care. So how does that kind of play a role in innovation and, embracing and adopting alternative approaches to care and long-term care?
So now I'll begin with Moira.
National standards, I think, would make a significant difference. Absolutely. They could include language that would recognize the need for relationship-based models of care, and they could attach funding to requirements that the homes uphold those standards. And I think that's something we're really missing provincially. And so the standards could look at the need for a social life, social connection, friendship, purpose and personal meaning during the day, freedom of movement, freedom to go outside. You can word those whatever way you want, but I think that will go a long way to setting a stage for real change.
And Andre.
Yeah, I think two things about standards. As Moira said, we can use them as a as a cudgel if there's money attached to it. So for me, the role of the federal government should be spending more money in this field, but it should be demanding standards in return. So I want provinces to stop hiding behind this constitutional argument. There's no constitutional barrier to cooperating and to saying yes to money with strings attached. So let's do it. And then the standards themselves, I think, would just set a ceiling, a floor, not a ceiling. So let's make sure these are minimum standards and not maximum. That's my only fear with them, as provinces will interpret them as I don't have to do any more than this. But it should be a way of setting the very bare minimum of what people can expect, because we don't know what to expect right now.
And John, would you like to have the last word?
I agree with both Moira and Andre. It's just national standards are important. They need to be tied. There needs to be resources coming too, and they need to be tied to that. And I think everybody should, as every level of government should get into this game, if you want to put it that way. National standards, I think, are a critical piece of doing that.
Thank you. Well, I'm just going to say a last comment just to wrap up this part of the event. We covered a lot of ground, and just with your answers covered a lot of responses to questions that I know so many people have been asking. You know, what went wrong? What can we do? What should we do? And then, of course, most importantly, how do we do it? And I want to thank you so much for the work that you do, both our journalists, for bringing truth to power, exposing wrongs, advancing rights, and making sure that voices are heard who need to be heard so that we can really make advancements. And to John, thank you for being an advocate and for your candor and your honesty and your willingness to advocate at Queen's Park for us. And on that note, I literally physically want you to go and do that. So John explained to us that he has to hop in his car and go for a long ride to Queen's Park in Toronto so that he can go and partake in tomorrow's session at Queen's Park. So John is going to say his goodbye now, but I understand that Andre and Moira are going to stick around as we go into the small sessions, the breakout sessions. So John, thank you very much for being here today.
No.
Safe drive and be well.
Okay, well, thanks very much, Josh. Thanks very much for inviting me. And please, anyone who's on this, feel free to contact my office at Queen's Park, or here in Ottawa. It's probably closer in Toronto at Queen's Park. And to Moira and Andre, thanks very much. It's a pleasure being on the panel with you here, and for all the work that you do to make sure that the public discourse is well informed, and it's very helpful to all of us at Queen's Park. And I'll leave it at that. And thanks very much, Josh.
My delight. No, thank you, John. And safe
Take care. Thanks.
So, one of the things that we discussed earlier is how do we get government to listen? Well, it does come from you, from all of us, and that's going to be part of the discussion that we're going to break out into now. So, Kathleen, over to you.
Hi, everyone. Thank you so much for staying with us. So we're now moving into part 2. I do apologize if we didn't get a chance to get to your questions. What I'll do is I will download and take note of all of them and compile them. So what I want to do now is I've assigned you all to smaller groups so you can engage in discussion. It'll be led by a volunteer who's also a member of the board for the Toronto Council on Aging. And we're going to ask you some questions tied to specific stakeholder groups. So some stakeholder groups are going to be focused on the needs of caregivers or essential family caregivers and essential family supports, the needs of frontline staff, or the needs of older adults and residents of long-term care. So that will be determined based on the room you've been assigned to. Again, when you're participating in the discussions, because it's a smaller group, you can turn your cameras on. So if you want to, so people can see your face or not. Again, you have the control to mute and unmute your microphones. Again, just keep in mind that it's okay to disagree in discussions. However, the goal of this discussion really is to come up with solutions. So we do want the discussion to be constructive and continue to move forward, because you're going to be reporting back to the group before we wrap up with your 5 ideas or suggestions or innovations for things that the Toronto Council on Aging can do with our advocacy efforts, as well as things that you kind of view from your perspective would be a step forward in support of that specific stakeholder group when it comes to long-term care and when it comes to advocacy. So what's going to happen is I'm going to open the rooms. And so this window will close, but don't worry, you're not getting kicked out of Zoom. It will look like a little window, and it's going to have an arrow saying it's taking you to the breakout room. When it pops up, you do have to click on the word join to be able to join, or else you'll be stuck in limbo. And then when you're in those rooms, again, you can use the chat function. You can turn your camera on, you can mute and unmute and really engage in discussion, but in a smaller, more focused perspective. So I'm gonna open them right now. So we'll start with Eric's group. Eric, are you back?
Yes, I'm back, and I think I see most of the members there as well. I'll be very brief. It was a wonderful conversation. Our group was tasked with discussing advocacy for older adults or our older residents. A few of the main points that were brought up is that, and just to be very brief, and I won't go into any great detail here, is that isolation seems to be a big factor. That can span multiple different age groups, but it's particularly an issue with the older adults, and it's something that we should be spending time and focusing on, especially when that moves into, say, mental health issues or dementia issues with the older adults. There's also the concept of one of our members talked quite extensively about the Oasis Senior Support Living Network, which started as a pilot program and it's since been expanded upon, giving opportunity for seniors to engage and live in a way that allows them to feel empowered to still live their life and support each other in a way that was similar to before they moved into that type of facility. And one of the last components that we discussed was that those older adults and the elderly population that have a supportive network and have opportunities to access recreational resources and other community-based resources do a lot better and are able to stay in their homes. And that's something that we should all be considering as a primary goal, making sure that older adults feel that they can live as fulfilled and as much as they possibly can within their own settings before we consider moving them to a different setting. I'll hand it back over to you, Kathleen.
Thank you so much. All right, I'm going to find Perry next. I'm just looking for Perry in her.
Yep, I'm here.
Yep.
Hi there. So the area that our group talked about was the family caregivers. And the number one issue that we talked about being the most pressing issue is support. What is the level of support, whether it's in a long-term care home or whether it's at home, and whether that person who's the caregiver, if they've got the physical and the mental support, because it's really overwhelming, particularly if you're taking care of someone who has dementia. You might even just want to go out and have a walk for the dog, right? So those are the little things. And in a long-term care situation, there is support coming in, but it's different strangers often. This is the paid support coming in. So then the family member feels it incumbent to go in and to help, whether it's helping eating, because so much of life revolves around eating and doing that with dignity, having showers, doing that with dignity. So by far the biggest issue is support, both for the individual and the support that they need to give for their loved one. And they are, part of that paid free labor. I think someone mentioned a $60 billion estimate or something. So without question, there's just not enough support and there's not enough services. And then the biggest challenge of navigating this really is what is the support? There's a whole silo of services available and it's just not integrated. People that are the family caregivers, they're trying to manage all the services And then they go into crisis, just finding it. I mean, one of our members talked about someone who literally had 18 messages, whether it's booking appointments for medical or just getting support, literally 18. And you go into crisis, and this is a stressful situation to begin with. One of the things that was helpful was learning from others with a lived experience. So whether it's, you know, someone from Sprint having an organization and a family meeting and a support giving meeting, but the biggest barrier is, how do you find these groups in the first place? So then based on that, you know, one of the things that the TCA can really do is to educate the community of caregivers on what supports are available, public versus private. I know a lot of work was done in the public sector to be able to have essential caregivers visit. Is that available for the private sector as well? If you're in a private care home, we didn't know, our members didn't know. So how can we consolidate all of this learning? Just educate, you know, what's available. And where can we go to find that? And also the need for action is now. So we can do all of this, but hands down, we need to act. And as a community of caregivers, so whether it's the Toronto Council of Aging, the Ottawa Council of Aging, an Ontario Council or whatever, let's share all those voices and really speak to our politicians and get some action today. And I think hopefully that captures it. Yeah.
Thank you so much, Perry. One thing I will say, I put it in the chat. I don't know the website off by heart, but the Ontario Caregiver Organization is a great resource we have in Ontario. It supports all caregivers, whether you're living in the community or have a loved one in long-term care. But they have support groups, they have resources. They are about 2 years old. I believe they were formed in 2018. Again, that's their mandate, is to support caregivers in Ontario. So regardless of your situation, if you are in that role and you're looking for some ideas, they're a great place to go. I'm going to go to
I can.
You want to go next? Okay.
Yeah, I want to go next. And ours was also caregivers. It was, I'm going to start at the bottom. It was the most exciting meeting and chat I have been at. I will just answer the questions as quickly as possible and let you know what happened. One of what do we see as the most pressing issues for caregivers? And we were covering people living at home and people in long-term care. And there was a story about a woman whose sister and mother, I think it was, correct me if I'm wrong here, living in a long-term care facility at which she is very unhappy because of the isolation. And visitors are given a rapid COVID test. And if it's negative, they can visit. And life would have been made much simpler if that same test could be applied to the residents themselves so that they could mingle with each other. They're isolated. They can only see the ones that come in. So that was one. Do we think there is a sufficient available support for yourself as a caregiver? We talked about how Alzheimer's and also Parkinson's Foundation are an enormous support. But try and get an answer from your LIN organization or your funder. Every sort of request for support is kind of seen as you're trying to get more hours out of them. You don't get the support. The private support is there, the organizations are there. And that is also what is the biggest challenge, navigating the system. And we talked about one person who was getting care for her 100-year-old mother who was, she does not have dementia, she was fine, but all these different specialities. Very nice. She pointed out that their navigator, their coordinator was excellent. but she would come in and ask a whole bunch of questions. Then somebody else with another speciality would come in with another bunch of asking exactly the same questions, but from a different department. And she felt that they were just going to go back and do the maths and work out how many hours to allow that person. So it was, navigating was not simple. What we did talk about was the disconnect between the community and services and the steps that people have to go through from the moment they need assistance to palliative care. And it was pointed out, a good example, now I'm going to forget the name of it. Remind me, Lynn, what was the name of the
Christie Gardens. Christie Gardens.
Christie Gardens, where it is a combination of buildings where you start off with when you reach a certain age and you don't need any help at all, you have your own apartment. And then as your needs progress, those services are available. You may actually have to move to another part of the building, but it's part of a spectrum of care. And that is an ideal situation. And of course, the whole thing is to keep people at home for as long as possible. And we talked about the Oasis. But what was so exciting was one of our members is a retired teacher, and he belongs to the Retired Teacher Association. Another member, where is she now? Here from Cambridge. And so they're going to get together, and they are going to work together. And the Cambridge group spent ages. This is an example of time wasted and government wasted. They were putting together a new development to put up a new planning thing, and everything seemed to be going fine, and then suddenly it was cancelled. Then we talked about the Oasis model, and you know, we've set up a network. A network has been set up with this group that are going to get together and work together in the community. And I didn't hear any talk about going to government. They're just going to look at different solutions and then ultimately go to government. But it is up to, it's repeating what Andre was saying, it's up to the community to get going and to have a voice. And this group is going to have a voice, I promise you. I think that's it. Have I covered everything, people? Lynn, did I cover everything? Okay.
Wonderful job, Jane. So
Yes.
I will pass it over to Tashia and let her speak to her group, which is focused on the needs of residents and seniors.
Yes, and I want to thank all of the members of my group for their contribution. We had a very, very lively discussion, and a lot of great points came to head. So I think Eric mentioned this, but social isolation and loneliness and the loss of contact has been a significant issue as a result of COVID-19 and the lockdown of long-term care homes. So we're highlighting that as a pressing issue for residents in this time. We're also suggesting that respect for the human rights for the residents is at the forefront of all planning, and recognizing that they deserve dignity and quality of care. And so there was a comment made about the residents not having a face, and recognizing that they are people and that they all matter individually. Another point that came up very resoundingly was that the residents need to be consulted in any solutions that are developed. And I think that as a TCA, we can certainly look at that in this forum as we are engaging with all of you today, and we are recognizing that the voices of older adults matter and that we need to consult with you as older adults and also with the long-term residents in any solutions that we're proposing to any levels of government. There was also a comment around empathy, just really building momentum on what's happening now. So using forums like this and the fact that we have the information and it's at the forefront to really use that energy to push us forward and to really plan and highlight some sustainable solutions. Another point that came up was the leadership model. So recognizing that the various long-term care facilities had different approaches to how they reacted to the pandemic. They had different timelines. And so really wondering how emergency planning and business continuity helped to impact how a long-term care reacts to any sort of adverse situation, or in this case, a pandemic. The last point I would sort of, the last points, is that there is a need for a liaison or ombudsman between the nursing home and the families in order to share information between the residents and their families so that there is a efficient two-way information flow. And lastly, really giving the residents an opportunity to contribute to any programs that are going to be developed. So giving them an opportunity to flourish and to pursue their interests based on where they're at in the continuum of abilities. So I think it was someone from Grand River, I'm forgetting her name right now, which I will ask her to unmute herself and identify herself. She said something that was very important. They have a model that says, no go, slow go, and go go. Recognizing that everyone is at a different stage and we're all coming at different points, but we all have ideas and we can all contribute to the discussion and help to develop solutions that work for us where we're at. So I thank my team for the feedback.
Thank you so much, Tasha. All right, we're going to toss it over to, let's let Sarah go first. And her group was focused on the needs of frontline staff.
Thank you, Kathleen. And I just want to say thank you to my group. We had a very good discussion that was very solution oriented. And I thought that was very, it was a very positive discussion. So the question of what do you see as the most pressing issue for staff? The key items that we came up with were the time to be able to support those individuals and their needs, as well as decent living wages and benefits as to be part of a stable workforce, as most of the personal care workers within the long-term care homes have other occupations in order to subsidize their wages at the long-term care homes, as well as having a registered or standardization of practice for personal care workers within that, so that everybody has the same kind of level of education, so that they're all at the same, they all meet a standardization or a level of quality. And lastly, having volunteers to supplement the care at the long-term care homes. And lastly, we talked about the risk of going to multiple care homes and how it's really hard to staff 24/7 without the use of replacement staff, and possibly having a closer relationship with hospitals and long-term care homes to have the backup staff for those institutions. So the actions that the TCA can take to advocate for positive change, as well as advocate for a healthy and safe work environment for long-term care homes, really stems from education on a transformative culture change into one of the new 4 models. And we discussed, should Ontario use the same model or a different model or a hybrid model? And we think that based on the location and what the long-term care home is providing, they should be using a model that best stems for them, but definitely a different model than what we're seeing today in most of the long-term care homes. We specifically talked about the butterfly model, as this is easier because they're buying into an already established program where they have to go in and have a year-long audit. So it's like a big job big investment up front. However, they see the cost savings in the long run. And basically, so there's a lot of education on the TCA's part. And then we advocate the government and make sure that they do not leave this pandemic without a commitment to improve the quality of long-term care homes, and make sure that the federal and provincial funds are used to help with those change. And then as well as developing a plan that we can have volunteers and a way to train those volunteers going forward to help supplement the staff at the long-term care home. Thank you.
Thank you so much, Sarah. And I'm gonna look for Melanie. Give me a second, where's her?
I've unmuted myself, not to worry. Hello all, I wanna first thank my group. We had a very animated discussion about the frontline workers in long-term care homes. We, out of our discussion, it was fairly clear that that training was a priority. Cross-training, to the extent it can be enhanced, was a priority, and improving job satisfaction, because job satisfaction would translate into better care for long-term care home residents. We spent a fair amount of time at the beginning of our discussion talking about how moving away from an institutionalized model to a model, or the various models that focus on smaller living units. One of our members talked about how it would be relatively simple to take existing institutions and break them down into smaller living units where there would be dedicated PSWs who would be given the opportunity to cross-train and would be committed to a particular small group. We then spent some time talking about the need for better wages for personal support workers, and it was suggested perhaps the Ontario government could be setting in the Long-Term Care Homes Act a prescribed minimum wage. And that is something we at the Toronto Council on Aging and other related organizations could be advocating for on behalf of residents. We spent a fair amount of time talking about the concept that was raised by the speakers around professionalizing PSWs, and I think the general consensus within our group was that was professionalizing was a good thing. It would enhance education. It would enhance standardization of qualifications. It would, enable or enhance longer term continuing education. And we talked a little bit about how it might make sense, for example, for the College of Nurses to oversee and absorb PSWs as a group. In the same way, I'm a lawyer, in the same way that our Law Society of Ontario has taken paralegals under our wings. So I think we came out of our group with a clear sense of what organizations who are committed to enhancing lives for older adults should be advocating for. And given that was one of the objectives from our perspective for today's webinar, I think we've achieved it.
So just to wrap up, we do want to thank you all for taking the time, especially on your busy schedules and Sunday afternoons, to join us for this session and this discussion. If you do want to learn more about the Toronto Council on Aging, please visit our website. There's a number of benefits to joining us. So beyond the town hall and long-term care, we recently wrapped up a program called Senior Centers Without Walls, where we offered phone-based social recreation programs at no cost. We offer wellness-based and health promotion-based programs. So we do have a yoga program going on right now. We have regular newsletters, webinar series. We have some exciting projects on the go. I know that ageism was something that you discussed. I can say that we had applied for a New Horizons grant, and we'll be announcing in the next few weeks something focused on addressing ageism within Toronto. So keep posted for updates about our call for people to help support the committee for that project, as well as nominations for people who are going to be involved in that project. And some details about memberships. So we offer individual memberships to seniors and non-seniors, as well as to organizations, so small, medium and large organizations. Again, we really do just want to help move the mandate forward as far as, having conversations and really benefiting, what it's like to age in Toronto and the needs of older adults in our community in whatever situation they're living, whether it's long-term care, retirement homes, or out in the community. And I'll pass it over to Tasha, who's going to wrap things up.
Yes, thank you, Kathleen. And thank you to everyone who has attended today's session. I just want to do a promo for part 2 of our town hall series, where we will discuss the role of naturally occurring retirement communities and the role that they may play in the future transformation of long-term care. So this event is tentatively planned for May 18th. We will be promoting this event very soon. So please stay tuned and look out for the registration details and promotional information. Lastly, on behalf of the Planning Committee, we thank everyone for attending the session today. We thank you for your feedback, and most of all, we thank you for the rich discussion. It was really, really helpful for us as an organization. To our esteemed panelists and the moderator, thank you for highlighting several ways that we can advocate for change, whether it be through community-based solutions, transforming the long-term care workforce, promoting age-friendly communities, and taking a closer look at alternative models of care beyond institutionalized care. As Kathleen has mentioned, we encourage you to visit our website to learn more about our programs and any upcoming events. And if you are not yet a member of the TCA, please do consider joining our community so that we can continue to bring you free events as we've done today on important topics like what we've showcased around long-term care. So thank you everyone, and have a good rest of your Sunday.